living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Mental illness is common in the United States. In fact, nearly 1 in 5 adults lives with a mental illness. And while that rate is similar in rural communities, there's a higher chance for suicide, and people face unique challenges in trying to get care. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown, and today we're going to talk about mental health, barriers to accessing care, and how people in rural communities can get the support they need. Stay with us. Welcome back to Healthy Living for Life. Joining us today is Dr. Reza Gomi, neuropsychiatrist and co-founder of Frontier Psychiatry. And thanks so much for being with us.
Thank you for having me.
It's always a pleasure when we know you've been on here before, so thanks for coming back, Dr. Gomi. Let's talk about some statistics and the stigma around mental health. We know that a significant number of people do live with a mental illness, so why do you think there is still such a stigma around mental health?
I think that the topic of stigma is a big one. I think it probably is more prevalent even in rural areas compared to other parts of the country. But the fact is, when you're someone struggling with any sort of mental health issue, what your impression of what others think around you and what your social circles think, whether it's online or in person, will have a big impact on how you pursue care or whether or not you even pursue care in the first place. I think historically, right, mental health has come a long way historically. It's a lot less looked at as a failure or something to be ashamed of. That's come a long way, but it's still a work in progress. A lot of people don't feel comfortable bringing up, especially if you're sort of maybe someone that's working on a farm that's extremely hardworking and can't give up a day, have a ton of responsibility. It can be pretty difficult to, for any reason, even if it's a general medical condition, to say, oh wait, there's something wrong, I need help. So I think that there's a lot of reasons, and it really gets into the complexity of the social fabric of where we're looking, depending on where we are in the country.
Sure, that makes sense. And that social fabric is tighter when you're in smaller communities. Is that why a lot of folks don't seek out mental health care?
I think so. I think there's a few kind of categories that the barriers fall into. Accessibility is an issue, availability of mental health, affordability, and acceptability. Those are sort of like 4A categories we think of when it comes to what are the barriers for accessing mental health, especially, and a lot of those are really exaggerated in rural areas. So I think we can kind of go into detail about each of those, but those are the general categories that really get in the way for people.
And rural areas are more susceptible to suicide going hand in hand with mental illness. Can you talk about that and the prevalence?
Absolutely. Depending on how we categorize, rural areas, but if we talk about, if we kind of look at what we might generally consider rural areas, there are, depending on how we draw the lines, by one definition, we can say there's about 9 million adults living in rural areas in the U.S. And so that's about 22% of the adults living in rural areas, 9 million have any kind of mental illness, and that could be any range. So it's not just severe, but it could be mild mental illness. So anywhere from reporting some depression you need to see your primary care about to having schizophrenia. So that's about 23% of all rural adults. So it's a huge portion, right? I mean, almost a quarter of all rural adults have some sort of mental illness. And about 5% of all rural adults, or 2 million people, have serious thoughts of suicide every year. So it's a huge issue, extremely prevalent. And so when we talk about in communities, if you're someone that lives in a rural area and you think, man, I don't hear much about it, that hopefully helps you understand that there are people around you that you're interacting with every day that fall into that category, and hopefully helps us feel more comfortable and to open the door to talking about it.
So living in a rural community seems to be a risk factor for suicide. Is age in rural communities also a risk factor?
Age is one of the biggest risk factors because it really predicts kind of your risk category. I mean, 80% of all suicides in the US fall in the age range for men and women of about 45 to 54. So that middle age is the lion's share. The highest risk category is actually adult men over the age of 85. Wow. Those are the most at risk. So age, as you get older, definitely tends to increase the risk.
Okay. People who do attempt suicide tend to show at least one warning sign. What are those so that we can look out for them?
You know, a lot of cases, especially when you read about in media, you know, you might be talking with people that knew the person and say, man, I didn't see this coming, or I didn't know. But really, as outsiders, when you actually look a little closer, there are warning signs. In fact, there have been some recent cases on kind of national TV, even related to gun violence or, you know, death with a gun after, you know, harming others. In each of those cases, there are warning signs. And so as a community, the more we know, the more educated we are, the more we can go to prevent and help our peers, you know, from getting to that point. But some of the warning signs are things like withdrawal from, you know, common activities, hobbies, depending on age. You know, if it's a kid, they might be missing more school or becoming a little more delinquent when it comes to coming to school, or missing work days, being less engaged with family. So look out for some of those symptoms. Sleep usually starts to get interrupted, whether you're kind of sleeping erratically or staying up late at night. Maybe it depends on the person, but sleep is usually disrupted. So those are some of the symptoms. They probably will come out and say some things that might not be directly asking for help, but bring up something feels off. You know, it might be very nonspecific, but if it's someone you know well, you follow your gut. You know, often your gut is correct. Something's not right. Something's going on with that person, and that can help kind of just maybe take that first step of offering some help.
Okay, great. And then how do we do that? What are those first steps?
You know, I'm a big fan of the CDC. The suicide page on the CDC is, you know, I think very comprehensive and has a lot of good direction there. But before you even get to that point, I mean, as soon as you have any concern, you would truly, for the audience listening today, you know, you'd be amazed at how powerful it is simply to just bring it up. It's actually better to name it. There's some misconceptions like, oh, if you ask somebody, hey, are you thinking about hurting yourself, or does that thought cross your mind? There's a misconception that you might be giving them that idea, or it is absolutely not true. It's understandable why you might think that, but it is not how things play out. I've, you know, after talking with hundreds and hundreds of people with suicidality, it's taking a weight off their shoulder to allow them to talk about it with somebody, right? It's not the opposite. It does not add to their stress. I think culturally there's a huge barrier there where it's sort of like, well, maybe I shouldn't bring it up. It's really, I would actually do the exact opposite. And if you have a concern with somebody, I would sit down with them and say, hey, you know, I've been really worried about you. Something's different. You know, your behavior I've noticed is a little bit different. I'm actually really worried. Like, are you thinking about hurting yourself, or is that something you've been thinking about? Put it out there. You'll be amazed at how far that goes. That'll set off a light bulb for that person, believe it or not, and know that they have someone to talk to. The key is no judgment, you know, it's a safe environment. The key is not rushing to call 911, you know, so you don't want to scare them and say, whoa, my goodness. But it's okay to set boundaries and have that discussion and say, hey, you know, that's a pretty big deal. That really scares me. Would you be willing to talk and get some help? It doesn't have to be with me, but that's why we have the crisis line. You know, it recently went national, 988. You know, the veterans have a specific crisis line through the same means. So there are ways to immediately access care. And I think depending on whether or not that person accesses care, you can just lay it out with them and say, hey, and depending how serious it is and how concerned you are, hey, I need you to get this help. And I'm really worried that, you know, I feel like I'm going to have to ask for help if you're not able to. So you can kind of, you know, layer it. But initial stages, it's about having the conversation. Okay. Not a big reaction from you, but just being supportive.
Okay, perfect. That's really helpful. Thank you. We have bumped up against a break, so we need to pause, but don't go away. When we come back, we're going to talk about some of the challenges that people face in rural communities when it comes to getting mental health. What are they and how can we overcome them? Stay with us. Welcome back. We're still talking with Dr. Reza Gomi, and we talked a little bit before the break, Dr. Gomi, about some of those challenges and barriers that folks living in rural communities can run into. Can you talk about how they're different from some of the challenges that people living in more urban areas would run into?
Yeah, absolutely. In rural areas, we talked about some of the stigma, and that's sort of part of this acceptability, of receiving or asking for mental health care. I think in rural areas, you're more likely to run into people that can make it harder. Yeah. You might go to get some help and you realize, oh, it's John from down the street's also the mental health counselor at the at the health center or at the school. I think that's completely understandable, and I think you should know it's okay to ask for somebody you don't know or try to pursue it in a way that maintains your privacy, because there's a lot of chatter, and that is a risk. That you'll run into people. So I think that's a big piece of it. I think there's a lack of resources in terms of trained people, that you have access to, affordability. Rural areas, because they have harder time accessing, often it's more expensive to access that care, but they also have less means to pay for that care. And so having a health insurance obviously helps, but even beyond that, there can still be a lot of hidden costs, especially with medications that might come out of that. Yeah. Availability too of just providers, recruiting providers to provide help in those areas. I mean, those are just some of the issues.
Yeah, and there's also a shortage of mental health professionals, as I understand it. And so why is that, do you think?
It's a great question. I think we've seen a few trends. I think with mental health professionals, it's not the most high-paying job out there, especially related to healthcare. So I think that, especially in times of economic stress, that can become more of a motivator. So I think that's challenging. But in rural areas, I think it's some of it's just a numbers game. In terms of bringing someone with expertise to an area that, a lot of our critical access areas across our states, Alaska, Wyoming, Montana, and even Hawaii and other areas, there might not be that many visits. So it's hard for an organization or a community to support the salary of somebody. And so really it's about sharing resources and being kind of clever about how we're going to bring technology and other ways to support it.
Yeah. And you mentioned affordability as well. So let's talk about health insurance, and what role does health insurance play when it comes to getting mental health care?
Absolutely. In general, your mental health care is covered by your health insurance, regardless of, the insurance. You might have Medicare or Medicaid, you might have a private insurance. Now, what's really confusing is some of that gets carved out and covered separately. Behavioral health can and often is carved out, which is a term they use in the insurance world to mean it's kind of paid from a different bucket of money, but it's invisible to us as the insured. We don't know. We just know we have Montana Medicaid. And luckily, Montana Medicaid does a great job of covering services. But if you have, let's say, Blue Cross Blue Shield, you might be part of a network that sends that claim to a different area. The key is to reach out for help, and our staff that you reach out to will help you figure that out. That's not meant to be on you, but it can be a big turnoff and kind of scary. But don't be shy about asking, hey, how much is this going to cost me? And can you help me figure that out? Ask for that up front. That's can be kind of hard to ask, but it's really important because in this country, unfortunately, insurance is very complicated.
Yeah, no, that's good advice. What about COVID-19? Do you think that's had an impact on people being able to get mental health care? Are we still seeing any ripple effects from that?
Yeah, when we looked back in the last couple of years, more than half of Americans reported that COVID-19 had a negative impact on their mental health. Looking at adults in Montana, 35% said they had anxiety or depression. And so it was definitely even in the last couple of years, and it continues. And those ripple effects will continue for years to come because there were a lot of traumatic experiences during COVID, and those, unfortunately, those stick with you for sometimes a lifetime. And so I think there's ripple effects that will continue, and it's certainly still playing a role. I'm personally still seeing patients that have COVID-related brain fog, anxiety and depression, and related symptoms.
Wow, okay. All right, I think we have time for one more question, and I want to talk about health literacy. It's a term we've thrown around on the show a little bit, but can you talk about what that means when it comes to mental health and people understanding the care they're getting there?
Absolutely. mental health and regular health literacy is one of the challenges in rural areas because it's referring to things just being up to date with some of even what we consider, what we take for granted, what's known, nationally, or what CDC might put on their website. It's not really known, in all areas. For example, I didn't know I could call, 988 for help because I'm in a crisis. Just having that health literacy, know that there's help out there. Or, it's actually, this is what happens when I have a high blood pressure for an extended period of time, or this is what happens if I have depression that's untreated and I don't do anything about it, or what depression is. So even sort of at the most initial levels, just knowing what are some of these things we consider health issues and what are some of the avenues for getting treatment. In the most basic sense, that's health literacy.
Okay, perfect. All right, we do need to pause here for another break, but when we come back, we've talked about the challenges and some of the issues when it comes to mental health in rural communities. Now let's talk about some of the solutions. We'll look at the brighter side of this topic right after this. Stay with us. Welcome back. Dr. Reza Gomi is still with us. And now let's talk about some of the solutions, or at least the efforts that are being made to help folks in rural community get the mental health care they need. We talked a little bit about the mental health professional shortage going on. How is that being addressed?
There's some ways it's trying to be addressed directly by simply recruiting, kind of the old-fashioned way, bringing bodies, to those areas and offering those services. I think that obviously is challenging, and there's only so many of us. I think one of the ways that's really been helpful, and COVID helped accelerate, for better or worse, is telehealth. So now you can ask for help from someone that doesn't live near you. Of course, there can be some maybe cultural gaps there that can be a little bit challenging. It's not perfect, but the data is showing that the care outcome is equivalent. There's no inferiority of care when obtaining care over video. So the key is how to make that more accessible. So now you can walk to your smaller rural, maybe FQHC down the road, but jump on with a specialist that might be in a different city. There's also a lot of growth of mobile apps, mental health technology. Some of them are just chat-based. Some of them even have bots that are not even, people behind it. But the key is all of them are trying to get at, how do I connect resources with the person, in the best match possible? That's the biggest challenge we face with mental health treatment, is how do I take the right resource, the right treatment to the right person? That is far from being solved, but in recent years, we've seen a lot of technology enter the arena.
That's great. And your experience, are more and more mental health professionals turning to telehealth, or that's something that's becoming fairly common?
It is. It's certainly the leading type of treatment provided via telehealth across medicine. When we think about all the specialties, behavioral health has the most traction. People are actually the most satisfied when we survey patients nationally. People are there's a big shift towards a preference because it's just so much more convenient. I think that outweighs the risks. I get to stay at home, or I can actually take a quick break from work and step outside in my car instead of missing the appointment or having to drive. So I think a lot of those benefits outweigh the concerns. So there is a big traction there, and there's no chance of it, I think, going backwards. If anything, it's going to grow.
That's great. There's also a movement to get mental health more integrated in with primary care physicians. Can you talk about that and some of the pros and cons there?
Absolutely. There are a few different types of this. There are some terms out there. There's co-located care, meaning you have a mental health provider in the primary care clinic and just, seeing patients as usual. There's also another step up called collaborative care that's been around a long time now, and it's been slowly growing across the country. And that's a model where there's a mental health professional in the clinic, but they're actually reviewing the entire clinic's population based on some questionnaire results, like a depression questionnaire, and then identifying who's at risk and then really targeting who's at risk. And so a psychiatrist, for example, a specialist, may not see everyone. They may just see the targeted few. That just provides a way to reaching more people with fewer resources. And so there are these sorts of attempts, these sort of care structures, if you will, or care models, trying to just reach more people. That's really what they're trying to do.
Great. Let's switch gears a little bit and talk about the social aspect of all of this and what's being done to help reduce the stigma and some of the things we talked about earlier of people just shying away from getting mental health care.
I think a lot of it is just the attention and talking about it, bringing it up publicly. Locally, where we are here in NAMI, Montana, does a great job of this. All of the advocacy they do legislatively in the general public, the groups, and similar types of groups. It's all about giving you the avenue to have something to talk about. AA groups, right? Extremely common and very powerful, very helpful. So anywhere you can go to see you have peer support, you have, people with lived experience, and other places you can find resources. That keeps moving the needle with the stigma and helping it feel more comfortable.
So as a community member, is that your advice? Should we just talk about it more, or are there things we can be doing in the community to help get rid of that stigma?
I think they go somewhat hand in hand. I think talking about it more is key. I think not shying away from the conversation. So whether it's a one-on-one or in front of your community at large, I would, get out there and voice your concerns or your support. That I think goes a long way. Help bring resources to your community. Maybe you have someone come give a talk, at your place of employment or at your school, wherever you are. There are a lot of ways, and if you look on some of these websites like NAMI Montana, they'll be able to connect you with resource or NAMI in really in any state. It's a very active organization, or CDC. Help spread that information. I mean, that's the best thing you can do. That's
great. And what about just cultural differences? How do we navigate that? Because that could be different depending on the community.
Yeah, and that's where I think models like the peer support models or peer advocates really comes into play, because what we were realizing is, healthcare in general, but mental health care especially, is very dependent on where you are. And so I'll give you an example. We teamed up with the Department of Agriculture to reach farmers and ranchers in Montana directly. So we took away the barrier. They don't have to worry about payment. They don't have to necessarily even come find us, right? We're making it as easy as possible. We're even doing outreach to them. And all of a sudden, we're seeing some people that had previously, not the highest health literacy, right? And had a lot of stigma against asking for help. Those are programs you can think of in your community to help reach people, not waiting for them to come to you. But making sure they have access.
Awesome. That's great. Okay, we have about 30 seconds left, but I want to talk really quickly about another resource that's coming, just emerging right now, and that's the podcast that we're partnering with Frontier Psychiatry on. Can you talk about that?
Yeah, thanks, Beth. So, I'll punt it back to you in a moment to say more about it, but I know the podcast, it should be about a couple episodes in now. It's called Breaking Barriers, Rural Mental Health. It's actually hosted by my colleague and co-founder, Dr. Arzubi. And so we're really excited to work on any collaboration where we help spread the word about it.
Yeah, we're really excited too. And people can tune in to basically anywhere that they listen to podcasts, they'll find that podcast. So we're excited to get it out there. There are going to be some great conversations about what's positively being done to support rural mental health care. So thank you so much, Dr. Gomi. We so appreciate your time and your expertise today. A lot of great information.
You're very welcome.
Thank you. And thank you so much for joining us. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.